The African Union and China both took a very direct intervention approach to the crisis of the Ebola virus. How significant were those initiatives in turning things around?
They supported us in two ways. One, they provided a lot of support to the ASEWA team itself. But then they also went on the ground in the three countries. Like in Sierra Leone, for example, they established laboratories which were non-existent at the time, increasing the resources that were needed on the ground at the time. Then they also helped us directly, apart from just the technical aspect of it, were helped financially in setting up what at that time was a very, very expensive procedure to which the African Union was new.
Commissioner, what is the African Union's strategy now to prevent a repeat of this outbreak?
We really need to bring up the health institutions. We have to strengthen the health institutions in the three countries, and for that matter, for the continent as a whole. Then our surveillance and preventive mechanisms also need to be boosted. And we actually need to have a plan for humanitarian disasters in Africa.
What role would the African Union want China to play in that strategy you've talked about?
Now, it's going to work in such a way that once the center is established, we expect from the government of China a lot of support in terms of facilitating the capacity of the member states to be able to report effectively to the center.
Before the outbreak of the Ebola virus, the economies of Liberia, Guinea, and Sierra Leone were thriving. Now, how important is it that China's intervention is needed in helping the Western Africa region as a whole in its journey to recovery?
The African Union is pushing for debt relief for the three countries. We're moving towards that because really, with the situation in which they are, it will be very, very helpful if we relieve them of some of the external debt in terms of rebooting their economy.